Hello, how are you? Welcome to the eye clinic. It is so nice to see you. I can't believe it's already been a year. I know, it's crazy, right? Alright, so it looks like they have you on the books for a comprehensive eye exam. Does that sound right? Good. Awesome. Alright. And like we begin all exams when you've come in over the years, just gonna have to ask you the same general questions as far as updates, any new medical conditions that I should be aware of. Okay. Good. And any new surgeries since you were last seen? Could have been anywhere. Okay. And any bad response to anesthesia or complications? Okay. And do you smoke at all, whether it's tobacco use or marijuana? And do you drink any alcohol at all? And how often would you say? So kind of more socially. Gotcha. Alright, any new family history of particular eye conditions, whether it be glaucoma, acute or closed, macular degeneration, or cataracts? Mom or dad's side? Dad. And do you know if it was open or closed? A lot of people don't know that. It's okay. All right. And are you on any new medications at all? No? All right. Now, let's see here. Have you noted any new visual changes, whether it be blurriness, black spots, notice it more harder to read or harder to see from far? Okay. And no fuzzy vision or... Okay. And no extreme headaches or dizziness? And you're not feeling a lot of pressure in your eyes or anything, right? You kind of feel like you're coming on with a stye. Okay. Which eye? That. Okay. All right. Oh, I'll be sure to take a look. Do you get them frequently? A couple times a year. Okay. And you are still wearing contact lenses, correct? Okay. All right. And those have been comfortable? You haven't had any problems with them at all? Good. Love to hear it. You're taking the acuity. Okay. For sure, we'll be sure to give you a box of those on your way out. All right. Let's see. Just going to jot down a few more things. So, we're going to start just from an external assessment. We're just looking at your eyes. It looks like you have a little bit of makeup on there. Are you okay if I remove it? Cool. Okay. Let's get you going here. I'm just going to grab some gloves. You have your contacts currently in, correct? Okay. Good to know. You've been doing good otherwise? Good. Alright. This is just a makeup wipe. Alright. Now, if you could just close your eyes for me, just going to kind of clear this makeup off. doesn't feel irritating, right? Good. Alright. Almost done here. Alright. Eyes completely cleaned off. Very good. Just going to change these out here. Alright. So, what I am going to do for you real quick is I do just want you to take your contacts out of your eyes, okay? So, I'm going to grab you a container with some solution. Let me get this set up for you. Oh, I totally get it. As a fellow contacts lens wearer. Would you mind putting contact in this one? Thank you. I see you're a removal professional. Don't even need a mirror, right? Okay. Then last contact here. Alright, if you wouldn't mind putting your contact in there. Awesome, awesome. I'm going to save these for you then, okay? Awesome. So keep those safekeeping. Alright, so we are going to start with an external assessment here. A lot of this, we are just going to start off with the pen light. I'm going to put on a new pair of gloves here. And you let me know if at any point you're uncomfortable, okay? Good. Alright, let's grab our assessment form here. So, first step is we are going to do an exam as far as the outside. I'll sort of evaluate if it looks like you're forming a stye. We're just going to take the pen light then, and I will write down my findings afterwards. So, we are going to start with this eye here. If you wouldn't mind just holding still the best you can. You're going to feel my glove here on this lid. If you wouldn't mind looking up for me. Good. Look down. Look to your right. Look to your left. I do see a tiny stye forming there, but I'll get you work up for that at the end. Okay, now I'm going to kind of pull your lid down here. Can you look up? Down. To the side. Other side. Good. Alright, we're going to take a look at this eye now. I'm going to hold the lid here. Can you look up? Down. Right. Left. Good. Gonna grab the lower lid. Up. Down. Right. And left. And you're just gonna look straight at me. We're looking at the iris of both eyes, the sclera. Looking at the lashes. Very good. Alright. It does look like in that eye you are about to get a stye, but I'll be sure to send you with warm compress and antibiotic, okay? Okay. Other than that, everything looked very healthy. So for the next part of the exam, this is where we are going to do visual acuity with the Snellen chart. And so with this test, you are going to notice that as you get further down, the letters get progressively smaller, and we are going to use that to test each eye as far as, what you can see and what may be a little bit blurry. It'll help us assess the vision essentially. Yes, absolutely. So let's get this part going here. Put that there. Alrighty. So, if you wouldn't mind covering one eye for me, we are going to start here. Can you read that? L-P-E-T. Very good. And we're going to try with this one here. Can you read that? F-E-L-O-P. Very good, very good. I am now going to have you cover your other eye for me. Are you ready? Let's go to this one here. E, D, F. That one was a C. C. P. Can you read this one? F, E, L. That was an O. All right. Let me just make note of my findings here, but you did just fine, okay? Sometimes the most simple test can honestly be the most stressful. All right. So we did the right eye first. Alright, very good. Next part here is I just want to measure the distance between your two eyes and your pupils. So if it's okay with you, we're just going to take a measuring tape here. You can just stand still for me. Measuring pupillary size real quick. Okay, very good. I'm going to pull this down. The next test is going to be the ocular motility testing, or mobility testing here. And so what I'm going to ask you to do is you are just going to follow this stick for me, but I don't want you to move your head at all. You just move with your eyes, okay? Okay. Good. 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 Look more at the tip here. Good. Excellent. Very good. Awesome. Good. Good. What I also want you to do is I want you to look straight forward at me. I want you to let me know. Just say now when you can see my glove here, okay? Yeah, assessing fields of vision. Good. 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 Now with this arm here. Good. 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 Excellent. Doing very good. The next part here is I am going to cover one of your eyes, and I need you to actually keep looking at O for me, this letter right here. And what you're going to do is you are going to keep staring at O with the eye covered, and then when I release, I'm just going to see how well your eye accommodates after it's been covered, okay? Alright, so I'm going to cover this eye. Keep staring at that O. Keep staring. Keep staring. Good. Now I'm going to try this eye here. Stare at the O. Keep staring. Keep staring. Good. Excellent. And that was what we call a cover test, which you did very, very good on. All right. The next thing we are going to assess is pupillary function. I am just going to shine a light. It may be a little bit irritating, but again, I just want you to continue to look forward. I want to make sure your pupils respond appropriately when there's light directly on it and then not. You're doing great. Awesome. The next part of this test here is what we call assessing for IOP, or intraocular pressure. Essentially what I am going to be doing is I am going to be taking an air-filled syringe, and it is going to blow air at your eye. We have a special test here where I then take just a little device and gently, dab it on the eye so that it can measure the amount of intraocular pressure going on from within. So really, the best you can, I just need you, we'll do one eye at a time, just to kind of keep looking forward, try not to blink, but you are going to feel a ton of air, okay? No liquid. All right, gonna feel some air, okay? You did very good. We're gonna give it one more go. Excellent. We're gonna assess the pressure of this eye. So give 1 second. Now we're just measuring it. Very good. That's normal. We're gonna do the same thing to this eye here. Ready? Very good. One more. Good. You're gonna feel just a little touch on this eye. Your pressures are good. Excellent. You are doing amazing so far. All right. Okay. So, before we begin with our retinal assessment, where we take an ophthalmoscope and we look inside to note the condition of your retina, we do have to put some eye drops in the eyes to dilate your pupils. It helps us see everything from the inside a lot better. So what I'm going to do is I'm going to insert the eye drops for you, but then I'm just going to have you sit for about a minute or two just to let the eye drops take effect. I'll put a mask over your eyes and just have you relax for the few minutes that we're waiting. That works for you? Awesome. All right. Well, let's get this going. All right. I'm going to put in this eye first. Very good. This eye. Excellent. You feeling okay? Okay, I am gonna have you relax here. You can sit upright if you want. You can lay down. But I'm just gonna put this mask over you just to kind of wait until everything takes into effect. Okay? Yes, awesome. Okay, here you go. while we are waiting for that to take effect for you, did you ever end up seeing that article on the World Health Organization that was put out a few days ago? Yep, yeah, it was addressing the 2022 conference on climate change. You know, one of the big topics of conversation was how really climate change is jeopardizing the lives of people all around the globe. It's super important for me to, advocate for things that could better the well-being of just humans, and just being very educated on, factors that play a role overall in our health. And one of those are environmental changes. So that is actually why this video and visit is sponsored by Ren. Ren is actually a site. Have you heard of them before? No. Well, they are actually a really great, easy website that can help each individual person calculate their carbon footprint. The way they actually do it is they ask you questions about your lifestyle, calculate your footprint, and educate you on how you can reduce it. And to even help offset your carbon footprints, you can make monthly contributions to specific projects that you may resonate best with. And one of the projects that I personally have focused on is the Clean Cooking Fuel for Refugees that is based in Uganda. This particular project helps create cleaner energy, improving the quality of life for refugees, lowering their risk for lung damage and disease, but also helping to prevent deforestation. Yep, and there are so many more projects that are that great. I'm actually going to send you with some info after the visit, give you information on how you can offset your carbon footprint on Ren. The first 100 patients or individuals who sign up using this link in my description will also have 10 extra trees planted in their name. Yes, yeah, I will definitely be sure they give you all that information at checkout, and you can go to the link in the description to sign up. Absolutely, absolutely. Well, I think it's time that we took off this mask for you. Are your eyes feeling a little bit dilated now? Yeah, all right. Well, we're going to take a look now with the scope here. We're just going to look in the back of your eye at the retina, look at the vessels, make sure there's no detachment and that everything looks healthy. We're also going to take a look at your optic nerve. Yes. All right. Alright, so you actually do not have to do much. It's just going to be me doing all of the looking, okay? Yeah, you can look at my glove here. Your retina looks very healthy. The vessels look good. Optic nerve is beautiful. Okay, let's look at this eye. Again, optic nerve, very healthy. Retina looks good. Awesome. All right. That wasn't too bad, right? Good. All right. So what I'm going to do here is let's take another look at your stye. Yeah. Look down for me. Does it hurt you when I press here? A little bit, but not too much. You know, it honestly should be able to go away on its own, but I am actually going to put some antibiotic ointment for you with this swab here, and I'll send you with a warm compress that you can apply to the eye, okay? Oh, my pleasure, for sure. All right. This is just some erythromycin. Just going to lift the lid here. I'm going to put a little bit more, okay? Don't worry, I'll give you the rest of the tube. I'll lift this here. colors. You want to keep the area clean. Honestly, take a break from contacts until it goes down. Wear those backup glasses you have. Yep, and then warm compresses. You can take a towel, put it under some warm water, apply a warm washcloth, 5-10 minutes, 3 to 4 times a day if you can. Okay. Awesome. Next thing I'm going to do is I'm just going to stock up your contact lenses here. This one is for the right eye. This one is for the left. So you have both of these boxes to take. Alright, and then here's the heating pad. You can always rewarm it in the microwave, okay? Oh, for sure. It's absolutely my pleasure. I'm just going to hold it down a little bit. I know they are so annoying. I've had a few of them myself. Alright, but other than this, you let me know if it gets more or if it gets bigger or you feel like it's infected, but I think it'll heal up nicely. And other than that, keep me posted if any changes. We'll send over your contact prescription. I'll give you the erythromycin, but otherwise your visual exam today was great. Absolutely, yeah. No change in your prescription. Oh, it was absolutely my pleasure seeing you, and I hope you enjoy the rest of your day.